Lorraine and I want to talk to you today about an important decision facing the nurses here at Munson Medical Center. They have a decision as to whether or not to bring in a third party to represent them, to have a union here at this organization. I think this will fundamentally change us as an organization from a culture and from many other ways. And so we wanted to really share some thoughts on that with you today.
You know, when I interviewed here last spring, I was so impressed by the nurses that I met, by the senior leadership team, by the managers and directors, and really the care that was happening here and the environment that I felt. I think it's something palpable when you come in this building that you can feel that positive vibe.
Absolutely.
And you know, with everything that's going on, I'm worried that we could potentially lose that and have a change in our culture. And I think about the things that in the year that I've been here that we've been able to accomplish. We've got our professional governance structure up and running. That's almost 150 frontline nurses being involved in making decisions that affect patients, affect patient care, affect their environment.
Absolutely.
So excited about that. We've done a lot of work around recruitment. We are down to just a little bit over 3% vacancy rate. Nationally, it's around 8.5% to 9%. So really unheard of, and certainly some of the lowest rates we've seen.
You know, no question, I've been here just over 4 years, so we're both relative newcomers coming from outside the organization. And one of the things you see when you come in from the outside is just how special this place is. There's something about the culture here, the collaboration, the teamwork, that really makes Munson unique in many ways. And you know, what I worry about bringing in a third party is how that could all be at risk. When I look at what I have been focused on, what we as leaders have been focused on, what the nurses have been focused on, it's been around transparency and communication and teamwork and getting feedback. There's been multiple avenues for people's voices to be heard. And that's the journey that we're on. That's the journey that I'm asking you to preserve as we go forward and we think about the culture and what we're worried about losing, what many of our nurses have shared with us that they're worried about losing. Where are you going to put your trust? Is it in the journey that we've been on over the last number of years, really for the last 100 years? Or is it in an outside third party? Is that where your trust is going to be? So we're encouraging every nurse that's eligible to vote to please get out and vote, and please vote no. We can't say it in stronger terms. What we have at Munson,
It's special.
is absolutely special. Thanks very much.